Okay, good afternoon. Today's Thursday. Looking back at the week, how have we done? Today, yesterday we're at 88. Today we're reporting 118. So we keep seeing this going up and above and around 100. That's not surprising. We're not jumping up to 200 to 300. That's what I don't want to see. And so far, we're holding the line. As we talked about before, we're in this phase of some people have, even the Chief Public Health Officer of Canada called it a slow burn. And I use that analogy of firefighting, forest firefighting, as a similarity. And the work of identifying cases, checking on contacts, case contact management, testing contacts, even if they're asymptomatic, and walling off and putting in control measures to limit any further spread outside that group. And we're seeing a number of examples of that in different health units at different times, where they may have one or two cases only, and all of a sudden they jump up to 12 or 13 or 14, and they have identified a cluster, usually related to a workplace or a social gathering or family type unit that have not been vigilant in usually public health measures. And they move quickly to test, identify, contain, and close it off. And so we're going to be seeing that off and on for a number of weeks ahead. But again, our volumes are that we did 118 identified yesterday as new cases. 77 more have recovered, 91%, so that's excellent. And another death, unfortunately, compared to 2 yesterday, 1 today. And also the 34 health units, most of them are reporting no new cases. And 18 have had no cases at all, while most of them have had under 5. But there are examples of ones that have jumped up to the numbers again. Toronto Public Health up to 36 today as compared to 23 yesterday. And Ottawa is at 22 compared to 16 yesterday. Peel 19, and that was actually going the other way, went down from 22. And Windsor, Essex had a couple in the last few days, but jumped up to 12 in their area. And even Durham has 10, which they haven't seen in that for a while. And again, a number of those were related to clusters with close contacts of individuals, either in a workplace situation or in a family community type gathering issue. The hospitalizations and patients ICU went up a little bit, not much in the last few days, and the number of patients on ventilators has remained stable. So we did 28,625 tests yesterday, and I just want to make a shout out to all the assessment centers. They've done a fantastic job. That's a lot to put through every day. 20, 25, up to sometimes 30,000. That's a lot of people received, a lot of people treated and met and assessed and tested and collating that data and getting all those lab samples in without losing the number on that. It's done a terrific job. So I really want to compliment our testing sites, Ontario Health, for all the hard work, and then the laboratories, I should use plural, and our network for doing a fantastic job day in, day out, 7 days a week. So thank you for that work. That we've had some contacts still. I've had some travel history and close contacts with that. We know in one of the areas that all of a sudden it jumped up with 10. They're mostly related to a family group with some travel history involved and contacts in that. So this is what we're going to be seeing rather than community-wide. We're going to be seeing these clusters, and we need to go out, find them, we're identifying them, and then you test the number of people who may say, well, I have no symptoms, I'm fine. But because they're a contact, we test them and identify them and ask them to carry out isolation policies to prevent any further spread. So most of the cases tend to still be, as a percentage, in the 20 to 39 age group, and some even in the under 19 age group, tend to be in the older adolescent area. Medical Officer of Health in Toronto, Dr. Eileen Davila, has noticed that increase also in their own respective jurisdiction, as is some others in Ottawa have said the same thing. So we're still back to what I've been saying all along. While we're going through these different stages, we're in stage 3. And unlike what people anticipated, instead of going from around 100 to 150 up to 300 to 400, we haven't seen that. Yet, we have seen some where people have not been responsible in carrying out all the steps of maintaining the distance of 2 meters with people you don't know, not in your circle. So continue to do that. Wearing a face covering when you're in a public place where you feel you cannot maintain that distancing. washing your hands with soap and water, hand sanitizer if you haven't got it, covering your cough and sneeze, avoid touching your face. If you're sick, stay home. If you think you might have contact, you might have identified, if your COVID app says you've been in contact, do go and get assessed and get tested. And remember your case contacts and that, and your circles, if in fact you are, so you can help public health to quickly contain it and help you and your social circle friends not to infect anyone else by less than diligent handling of your protocols. So over time, we're seeing decreasing cases week over week, and we're seeing the similar trends across all the areas, with most of the ones percentage-wise being in the 20 to 39 age group. The deaths continue to decline in numbers, fortunately, but unfortunately, they still are occurring. And we're down to less than 5 deaths a week now for 4 weeks in a row. Well, that's good news. It'd be nice to have none related to this issue, but we'll have to keep monitoring it. So exposures, as I said, most tend to be in close contacts in a community, family gathering, or in some workplaces that we're identifying. Still, if you are travel, some people are not being adherent to the 14-day quarantine period, and so they have to be reminded that that is required by federal law after you come back in the country from being outside, even for a short period of time, and issuing those exceptional groups, as in truckers and others who go back and forth on a regular basis to deliver essential services. So the outbreaks in that, I've noted. The main theme, of course, we're hearing these days, and what we did our press conference today, is back to school. And as I've been trying to say all along, this aspect of infection prevention and control, all we've been talking about all the way through, with the ones I just mentioned, the distancing, the masking, that's all part of infection prevention control. It's quite mechanical, it's quite logical, and it's very routine. And what you want to be able to do is to get that for yourself, and then some things for your children to do, so it becomes second nature just to do that. Much like you train them early on how to approach a street and how to cross a street. You do it again, you keep watching, you observe, and make sure they're consistent in those behaviors. The same as I'm talking about school when you're getting ready for it. It's training yourself and your children. I talk about getting the backpack ready, and I talk about getting the eye infection prevention control ready. Because how do you do that in the school? And the guidelines have gone out. They're available on our coronavirus webpage. You can scroll down under schools and education. And I advise you, if parents or otherwise, to keep checking to see if there's any future updates, as we will continue to make sure they're up to date with any new science and evidence and issues that are concerned, so that you can be kept as well aware as you need to be, because you need to be assured of what's happening in your community, because your community is where you and your family are residing and where the school is situated, and then also what is happening at your school. And we want to put all those things in there. When we talk about infection prevention control, it's not just a one thing like put on a mask. There's a whole bunch of things you look at. And we've been saying in the process, with our public health nurses coming in there, with other experts coming in, you look at the layout of the plant, how the processes are happening. Are the students adhering to wearing masks? Are they in this cohort or that cohort in that group? Are they watching themselves and how many go to the washroom? How are the recesses handled? How are the lunches and how the food? How's the bus transportation? Loading, offloading buses. It's very, at times, seems at first meticulous, but that was already happening before. I remember always rules about when to line up before the bell rings and what you have to do. And with fire alarms, what you're supposed to do. That's part of learning what's necessary. And now it's learned about infection prevention control. And it's the same as the parent. As you assess your child, if they're feeling unwell, and you know best when they're unwell, then keep them home. And see if you need to get them assessed by either your doctor or a healthcare provider, or if you think is COVID-related because you know maybe some potential contact, then you may want to engage on how to get them tested in a timely fashion. If you're doing that, make sure you notify your public health nurse who is assigned to your school, as well as your administration, because part of the infection prevention control policy is that everybody's in this together. And the confidence and trust we build is being forward-thinking and advising and telling, even beyond that, still protecting privacy and those aspects there, but so that the school knows, the nurse knows that student A, B, or C is not in today for maybe non-medical reasons, totally. But at least we're aware of what the absenteeism is. All of a sudden, 10, 20% of a class or cohort's missing. What goes on there? It's just by happenstance that 5 or 6 children all had the same appointments with different things, nothing to do with medical at all. Okay, false alarm, things are okay, and we move on from there. But that's all part of that notification. So we put those guidelines out. People had a number of questions on in there. What happens if there's a child who's ill? How are they tested? How's it carried out? It's very methodical. It's the same and consistent as we've done with these other outbreaks I've told you about. And what are the rules about a suspected case while they're getting tested? What are the rules about a positive case? What are the rules about the family and siblings of a positive case? What are the rules about the other classmates or cohort of a positive case? It's all in the guidelines and how you follow through. When is there a concern with a cohort or classroom? When is there enough to cause a school outbreak declaration? And how's that done? It's not done just by casualness. It's done very carefully, timely, and to protect the overall health and safety of the students and the teachers in that facility. But that's in consultation with the public health nurse, with the school administration, and with a local medical officer of health, who will make an ascertainment of whether it should be done or not done. And then what are you going to do with that? And what's the communication that needs to go out? Because, of course, as parents in that, you will want to know what is happening, how am I going to be kept updated, or am I just sitting at home waiting for answers? So we got to be very good at that. We have to move on that proactively. So we're setting all those processes in place. Make sure the coordination, the communication, the enhancement, the testing, the timeliness of it, the effectiveness of it. These are all things, while they seem like jargon words, they're critical in an infection prevention and control response and case contact management. So we'll be talking about that from different times in this media event. Have a read, look at the documents. If you have questions around the school one, talk to the school. If you have questions about the public health one, talk to the public health unit. And there's contact numbers there for your local health unit. And we hope in a short time you'll get to see and know who are your nurse or nurses that are assigned to your school, and that you would build a communication relationship with those staff, as well as a trust confidence that they will give you the information you need when you need it in the context you're asking for. So that's all I'm going to mention today, but I'm going to more open up for questions from the media at this time.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Your first question comes from Colin DeMillo with CTV News. Please go ahead.
Hi, good afternoon, Dr. Williams. I'm just curious, so as kids return to school, many of those children and families obviously have their grandparents included in their personal social bubble. What is your recommendation for those families when it comes to students who have returned to class and their contact with grandparents who might be elderly, who might have underlying health conditions? Should they be keeping their distance now? Should they exclude them from their social bubble, or revert to kind of some of the previous distancing rules?
I think that's a good question. I think because your children have been there, obviously the exposure of your parents or grandparents to them, you have maintained that with your social circle. We assume you haven't let them go out and play casually on the street with 20 other kids. Maybe they have. I hope they haven't, but if you maintain that diligence throughout that time, when they go to the school setting, then it's going to take you a time for you to be satisfied as the parent. This new cohort that my child's in, it may be the class, maybe the same size, or maybe a subgroup of the class. It depends how the school administration does it. And who are the children in that group, and how am I satisfied that that cohort is being handled right? The supervision, the coordination, the maintaining of the infection prevention control practices is to my satisfaction that at least it's equal to what we have done. If you're saying the we, the royal we, in your social circle. And in that case, then you may say, okay, now we can start visiting with the grandparents again. That's for you to assess, of course, when you're comfortable that you feel that the consistency of the protection has been followed not only in your social circle, but you're satisfied it's happening within the school setting of how your child is doing, whether they're being taken to school or they're going the bus to school, and the cohort, how it's being handled, because it's all, in your mind, a bit uncertain, and you want to be appraised of that. And I think as a parent, with other responsibilities for people who might be immunocompromised, you want to be affirmed of that before you open up and allow that contact back again. So it's all part of your assessment, and we're going to try and help to get that enough information to you to be able to make that decision wisely and in a timely fashion.
Follow-up?
Okay, and a brief follow-up in terms of child care centers. Do you know, have we had a lot of outbreaks associated with the child care centers that have reopened? And what should parents of children returning to school take from that if there haven't been as many outbreaks associated with that?
Well, we have from the beginning when we've opened up, we have followed up on in cases where there is a suspected case, a possible case, and even just one case, and testing the staff, testing the other children, and if there's a child identified as positive, testing the family back behind it, and then trying to assess that. So we hear lots of ones where there is a suspected or possible outbreak, even if there's a child who's ill and they're working the child up, and we're being on the overly cautious side. So we're asking our teams and our overall coordinating committee, because a lot of these child care centers are under the auspices and licensing by the Ministry of Education. So it's part of the overall responsibility to monitor that and to see how it's working. We're going to ask our public health nurses too, if there's a child care at your school or schools that you have, that you're also responsible for looking at that as well. So we want to make sure that has the same consistency all the way through. We have had some where we've closed some and we've opened them up again, so it's not that we haven't done that, and we will do that. And it's, again, following a due process of identification, containment, testing, managing. I'm not going to go through it all again, but we're doing that in those centers, and they will be happening in parallel with the classrooms and the schools as well.
Next question.
Your next question comes from Rob Ferguson with the Toronto Star. Please go ahead.
Oh, hi, Doctor. I just wanted to check back in with you on the social circles. I think it was Monday we were talking, and you were saying that you had some guidance likely coming about expanding social circles, and yet yesterday, Eileen Davila, the medical officer in Toronto, was telling people to stick to their one bubble, and she's concerned about these rising number of cases, as is the medical officer in Mississauga yesterday, Dr. Lowe. So you seem to not be worried about the cases going up a bit, and they are. So I'm just wondering what to make of that. Don't we have a bit of a problem in Toronto and Peel, and maybe in Ottawa?
Right. So following up on what I said at the outset, Rob, I think I've asked our public health measures table to say if we're going to do a wide policy change in social circles, cohorting or bubbling, is it increasing the size from 10 larger, or is it going to be, can you manage multiple cohorts? So could you be a member of 2 cohorts or 2 bubbles or 2 social circles? And how would you do that? So they haven't come up with any broad recommendations. They've been trying to watch the staging and to see how we're doing in stage 3. Are we seeing this uptick in some cases, which we haven't really seen? It's been, we were about 2 weeks ago, we were at 150, 160. Now we're coming down, and we come down below, then we go back up. We're all hovering around 100 every day. And I think the concern with Dr. Davila and with Dr. Lowe is that they're seeing some people, especially some of the younger people, not adhering to the public health measures and the social circles. So having very close gatherings with a random group of people. And that is causing concern when they have to do an outbreak of a party or whatever and find out there's a number of people have not been responsible in doing that. So by opening that up, there's a concern saying, well, if they've been casual that way, would they be even casual even more? I think the part I have to say is a lot of people have been very careful about that and have taken it very seriously. Some have done their own alteration, have sort of been in one bubble or one cohort and then isolate themselves for 2 weeks and then asked to join another one. So there's things that people have been doing. We're just looking for some guidelines from our public health measures table if we would do it system-wide. Now that we know that we've gone to stage 3, and unlike some predictions of saying you're going from 100 to 110 up to 200 to 300 cases in a day, we haven't seen that yet. So, but that doesn't mean that even before we went to stage 3, there are some groups already doing that behavior as it was. So I think what Dr. Davila and Dr. Lowe are concerned about is, do you want to give more opportunity for even more lack of diligence? And it's a good question. I think a large part of our public and a number of people, 20, 39, have done so responsibly in my mind, but there's still individuals in all age groups that I find and hear stories of that are less than careful in the whole process. So it's a balance, and we want to be aware of the risk out there. And of course, you heard, in a way, we have added another cohort to your list. If you're a parent, your child has joined a cohort, whether that's the same as a class size or whatever in the school. And if you have multiple children, you've got multiple cohorts to think about. So this is a new thing to handle. So whether you have that or not, you're going to have to look at how you understand that. Do you know, and how can you assess that? So the answer is we're waiting for PHMT to come out with any overall system-wide, province-wide changes to the social circles concept. their evaluation of how we're doing in our staging up, and then how we integrate this in with our school systems, with our cohorts in those settings as well. All this is happening live time. And then we have also returning students going to university, and how they're going to do that, and how university is going to run that. So all this is a lot happening all at one time, and of course that concerns medical officer health, saying, is it too much shifting at once to keep track of these things? And we're trying to make sure that our testing, our monitoring, and our surveillance and case contact management can keep up with those different settings, that there's different checks and balances, and that each of those institutions and areas are doing their due diligence in maintaining the public health measures that are suitable and have been identified as required for their unique settings, their population, their groups, as they go forward into this next phase in the fall.
Follow-up?
Excuse me. Is there a message you have, like with school coming back, universities going back, kids are going into residences? I'm thinking you must have like some kind of a contingency plan for a sudden jump in cases, and what is that plan if we do get up to that 200 to 300 a day case level that you mentioned in your preamble for the news conference? Because I remember you saying when we were thinking about coming into stage 2 and stage 3, you wanted the cases at or below 100.
Right. Remember, my first number I want is below 200, and then I'm always demanding more. We got below 200. I want it below 150, and keep going down. And we're trying to address the fact that can we get our number even consistently well below 100? And we have these blips and jump ups. What is the issue here, and are we containing these outbreaks? So I think we are working at now documents to say if there was some resurgence, as we're seeing in some of the other countries and some of the other provinces in Canada, what steps would we take? And is it a repeat of wave 1, the initial one, or is it a variation in there? And as I tried to explain in the press conference, the difference between then and now is then we had a large influx of people from outside who we didn't know were infected, ended up in a large number were infected, and that was a widespread, and we had community-wide transmission. So we had to do a fair, strong lockdown. Now, if we were maintaining our borders as best we can, and we're continually having dialogue with the federal authorities on how to do that, do it better, do it more consistently, to ensure all this investment we've done in Ontario is going to stay. How do we do that? And so that if there was all of a sudden numbers go up to 200 or 300, if they're all in 2 or 3 health units, we'd say the local medical officer health, okay, is it a work type thing? Is there a whole bunch of workplaces that are collectively? We have to close all those down. Instead of saying writ large, is it a school-based one? Is it a university one? It doesn't take a lot to rack up 150, 200 cases in a large place with 10,000 people. So is the local response is adequate? Do you have to have a regional response? And then coming up, do we have a provincial response saying, okay, all these types of areas are now for the moment closed until further notice, until we get on top of this. So there's a staging which is different than the first one because we didn't have the luxury of having already good case contact management, and we had the influx of cases that we were not even aware of were coming in. So we're in a different situation, but we're doing that, this is you asked about, we're doing that staging and resurging. How would we do that? Locally, regionally, provincially.
Next question.
Your next question comes from Jessica Smith with Queen's Park Briefing. Please go ahead.
Hi, Dr. Williams.
Hi,
I was
Jessica.
wondering if you have any information on how much risk teachers will be facing when they go back in the classroom. Is this a zero-risk situation for them? Is it any greater or less than, say, the people who go to work in grocery stores?
So in that, I'm trying to be very pragmatic on infection prevention control. And if you do as you're supposed to do, if you're wearing your mask, if you're staying home if you're sick, you're aware of any unique issues that you may have to deal with personally, you're wearing gloves, you're doing hand hygiene, you're doing the distancing consistently, you work out how that works in your area of teaching, whether it's secondary school or primary school, elementary and JK versus grade 6 or 7, they're all uniquely different. And there's things that we want to put in place that you need to do and do again and do consistently. We were trying to say with our grocery retailers and that by having them stand back, we had the whole, remember, the dance, step forward, step back, all those things we put in place, the plexiglass. There's different things we do where we reduce the risk to that worker in there. And the same as we're trying to work through with the teachers in that aspect, as they become trained in infection prevention control, the same as our healthcare workers who are looking at their patients who are infected and ill, they have to maintain their consistency in their IPAC practices. And so we want them protected. So by doing what you need to do every time, all the time, and being aware of that, you will not be at risk, because it's a virus. It's droplet spread. It doesn't happen by magic. It's distances and things like that. It's been tested all the way through our whole outbreak thus far. So you want to make sure that's what you're doing. You consistently do that. If you do that, you will not be at risk. What happens when people, and we even watch it sometimes in some healthcare settings, people, you're saying, what are you doing? And I forgot. And so that consistency is really important as far as that. And that's the same as you would drive in a car. If you get distracted, even though you thought you were a great driver, you're going to be in an accident. And you have to be focused all the time on the issue and reduce your risk. So I don't think they'll be at more risk than other people if you do all the infection prevention control practices as we're supposed to do. And that's what we're going to be continually working to saying, how are you going to do it? Is it working well? Can it be done better? And we're going to continue to address that, because each school is slightly different. Student body mix is different. How it's set up is different. And we want to make sure it's the best for that situation to protect the children and the teaching staff and custodial staff.
Yeah, just to clarify that, so are you saying that teachers won't get COVID-19 if they do everything right, or are you just saying they won't be at a particularly elevated risk other than essential workers if they do everything right?
Our investigation, even with our healthcare workers, when we go back and ask them where they look like they got on the job, we often find that they got it back in the community. And so you can get COVID. You may get it. We're trying to make sure you don't get it in school. We'd like that not to happen. Why? Because it has a big impact on everybody. But if you then go home and casually go around and don't wear a mask and go off to the mall or wherever and expose yourself, that would be really bad. And community spread, community contact with cases and that is still occurring. Or you decide to take a trip and didn't tell anybody and you went to an endemic area. It's that can happen. So I can't say that you won't get COVID ever, especially if you're not careful in both the school setting and in your personal life. You got to do both consistently in this current environment we're in. And so our approach has always been those people who are very careful and are consistent in their practices, we usually, when we interview them, they do not get infected. It's when they interview and they say later, I said, I guess I got casual in that event. I didn't think it was a real issue. The person said they weren't infected, then I found they were infected, and I didn't wear a mask, and I got in close contact. We had a close conversation for 10 minutes, and that's what happens. And so we don't want anyone getting infected in the school, but we're going in full prepared to look for it, seek it, find it, test it, and to affirm and rule that out as quickly as we can. That's why we're moving all these nursing staff into those school settings, and we want to make sure we're not going in just being careless about it or casual. We want to go in assertively looking, and if we find it, we'll be telling you as soon as possible and protecting you and other teachers and other students, other custodial staff, and of course their families at home by keeping them informed.
Next question, and this will be the last question.
Your final question comes from Brian Lilly with the Toronto Sun. Please go ahead.
Dr. Williams, a number of the organizations representing teachers have dubbed the return to school unsafe September. So I'd like to know, as the Chief Medical Officer of Health, someone involved with the plan, do you see the return to school as something that is unsafe? And how many doctors were involved or consulted in putting together the back to school plan?
So you put in the right context, Ryan, that we take all the advice from all the experts, both in our local area. I mean, we've had the report from the Hospital for Sick Children. We've had and made of a lot of physicians. We have our science tables. We have our public health physicians across the province in different levels. We have our federal, provincial, territorial committees, and each of their asking all their experts and their scientists. We have our National Public Health Agency of Canada and WHO, and they're doing lit searches and comparing all the jurisdictions. So we're talking about hundreds and thousands of doctors and different groups weighing in with the latest information material. As always with science, we have theory and we have idea. We want to back it up with evidence that's solid, defensible, peer-reviewed. And our information and data this time says it is safe. But it's safe if you do infection prevention and control. If you set up the things that we're doing, as we've been saying before. If you seek to do some distancing, if you can't, wear masking. If you can't do that for some unusual reason, do something different. If you're ill, stay at home. All those things we said. It's not just a one magic button. It's a number of things you have to do and do it again. That's what makes it safe. And schools know that because safety issues, whether it's things with bullying or behavior, these things have to be worked at all the time. So there's other things besides infection that you're aware of, but then schools put in place things in education, knowledge, and training to avert those and mitigate those consequences. The same as they're doing. So if we didn't think it was safe, if our experts told me it wasn't safe, if our ones that are looking at our data and information said it's not safe, if we have a large community cluster in an area of the province that said, I think it's too risky to have the children to go, I would take the advice of the local medical officer of health and saying that you have very good evidence and good data that supports that. You're making a recommendation, let's follow up on that. So if it wasn't safe, either I or medical officers of health or the Ministry of Education, we would be taking steps to curtail that and mitigate that as possible. And as I said, there's hundreds and many doctors around the world and experts and scientists, not just doctors, but researchers and epidemiologists looking at this data and continuing to up our knowledge base on that and see if there's any gaps and narrowness in there. And if there's a risk or hazard, we want to know as soon as possible if it's evidence-based, if it's peer-reviewed, if it's solid. We have lots of opinions. We need something more than that. We need consistent data and evidence.
Follow-up, and this is the last question.
Would you recommend for your children or grandchildren to go back to school as students or teachers this September?
Yes, I would. Just because of the thoroughness of it and what we're doing on that basis there. So, and I can see the effect on some when they don't go back in that way. And we've been made aware of that by the scientists and doctors. They're saying, do you know that by keeping the children out, you're doing harm. You need to be doing something about it. You need to correct this. And so that information is there as well. And so we are worried about the total holistic health of the children, not just the infection one only. And that's what it's about. And so, yes, I am making that recommendation. And I know one of mine is all excited, already got a postcard from the teacher and is just thrilled to be going back in that. So I'm excited for them in that. And we'll be watching the whole thing and seeing what they're learning and all the experience of the excitement of going to school and what they're going to do with their peers and friends. Some of them they've missed for quite a while. So, yes, I am supporting that.
Thanks, everyone.